This is Health Dose, a podcast from MyMichiganHealth focusing on different issues related to your health. In this episode, we speak to nurse practitioner Belinda Bryce, who specializes in family medicine and sees patients at MyMichiganHealth Park Birch Run. The CDC reports more than 38 million Americans have diabetes, about 1 in 10, and about 90 to 95% of them have type 2 diabetes. Type 2 diabetes most often develops in people 45 or older, but more and more children, teens, and young adults are also developing it. Today, Belinda will be talking about what is important for you to know about type 2 diabetes. And so, Belinda, let's start out by simply asking, what is type 2 diabetes?
So type 2 diabetes is the inability of the body to use glucose normally. Glucose is what our cells use for energy. With diabetes, glucose is not able to enter the cells properly, and this leads to elevated glucose in the blood, which can lead to many other problems and cause a lot of damage throughout the body.
What are some of the most common symptoms that you see in type 2 diabetes or patients that come and see you? What are those common symptoms?
So someone may have prediabetes or even be diabetic with no signs or symptoms for several years. Symptoms can be very insidious, so that people may not even notice symptoms as they appear. But what they may notice would be increased thirst and hunger, increased urination, frequent infections or wounds that are slow to heal. They may feel fatigued. They may notice some blurry vision. They may have sensations to their fingers or toes, such as tingling, numbness. Some people will notice a discoloration, a darkening of the skin around their neck or in their armpits.
And so if those are the symptoms, what leads to those symptoms? What causes diabetes?
Diabetes is caused from a combination of insulin resistance and decreased insulin production. This is with type 2 diabetes. The process starts when the cells in the body develop a resistance to insulin. Insulin is a hormone that allows glucose to move from the blood into the cell. When this occurs, cells in the pancreas increase the production of insulin to help the transport of glucose into the cell. But over time, the cells that produce insulin start to fail and they're not able to keep up with the increased demand.
Again, joining us today to discuss and understanding type 2 diabetes is nurse practitioner Belinda Bryce. She sees patients at MyMichiganHealth Park Birch Run. We've gone through some of the symptoms, the causes, what exactly it is. And so let's ask, what are the risk factors of type 2 diabetes?
There are a lot of contributing risk factors to developing diabetes. Just aging in general is a risk factor. The older you get, the more likely you are to develop diabetes. It also includes family history of diabetes. There's a strong genetic link to developing diabetes, inactive or sedentary lifestyle, being overweight, having a poor diet, especially a diet that has a lot of added sugars or refined carbohydrates. Another risk factor would be central obesity. Carrying extra weight in your abdomen versus your hip, thighs, or buttocks also increases your risk. For men, that would be having a waist circumference over 40 inches or 35 inches for women. Poor sleep habits, excessive stress, low vitamin D can also increase your risk. And women that had gestational diabetes during pregnancy are at increased risk for developing diabetes later in life.
Feels like you started to get into almost some diagnosis there a little bit too. How do you go about diagnosing specifically?
Diagnosis is through lab work. It can be done with a hemoglobin A1C. This gives us a long-term average of your blood sugar. Under 5.7 for this lab is normal. It can also be diagnosed with elevated fasting blood sugar levels over 126 on 2 separate occasions, or through a glucose tolerance test where you drink a high glucose drink and then your blood sugar is checked at specific intervals to see how your body is able to handle it.
So we've gone through the symptoms, the causes, some risk factors, how you're going about diagnosing type 2 diabetes in your patients. What are the longer term complications that you see with this disease?
There are many complications of diabetes. There is an increased risk for organ damage to several systems, including your heart, kidneys, and eyes. It can lead to nerve damage, resulting in neuropathy, gastric symptoms, or erectile dysfunction. It is very hard on your cardiovascular system. It puts you at risk for developing heart disease, peripheral vascular disease, and vascular-related dementia. You're at increased risk for having a heart attack or stroke if you have diabetes. It can also affect your immune system, causing decreased ability to fight infection and heal wounds, and it increases your risk for developing cancer.
So then what are the most common forms of treatment that you engage in?
So treatment always includes lifestyle. Counseling patients and having them change the way they eat, eating a whole food, plant-based diet, limiting added sugars, limiting processed foods, and complex carbohydrates is very important for the management of diabetes. Also, increasing activity. This increases insulin sensitivity at the cellular level and will help to use glucose that is in the blood and therefore decrease blood glucose levels. Getting adequate sleep, staying well hydrated, and controlling stress will help to manage diabetes as well. Regular follow-ups with your primary care physician, having labs checked regularly, and monitoring blood sugar at home is also very important. Getting routine screenings and eye exams to watch for any damage that may be caused from having diabetes. And even though if we do all of these things right, often we still need to use medications to help manage and treat diabetes. And fortunately, we have a lot of development and some great options for medications.
When should folks listening potentially reach out or see a healthcare provider if they have type 2 diabetes?
Ideally, you would be following with your primary care provider regularly before there are any symptoms or before developing diabetes. This way, you can be counseled on ways to prevent or delay the onset of diabetes. Otherwise, if you have any of the risk factors that we discussed or any of the symptoms that we mentioned, you would want to see your healthcare provider right away.
So we mentioned at the open about how more and more children and teens and young adults are developing type 2 diabetes. Why are we seeing that?
I think that comes down to our lifestyles that we are seeing now. Our children are much less active. They're not getting regular exercise as they used to. They're not outside playing. Children's diets have changed considerably over the past 20 years. They contain much more added sugar than they did in the past, much more carbohydrates, processed foods, and less healthy whole foods than they used to.
Again, a special thank you to nurse practitioner Belinda Bryce on this edition of Health Dose. She currently sees patients at MyMichiganHealth Park in Birch Run and is accepting new patients now. To schedule an appointment, call 989-624-1500 or visit www.mymichigan.org/doctors.